A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a high-stakes political maneuver, House Republican leaders have pledged to address the looming crisis of rising health insurance premiums as the expiration of Affordable Care Act tax credits approaches at the end of the year. With over 20 million Americans potentially facing skyrocketing costs, the urgency is palpable. House Majority Leader Steve Scalise announced plans for votes next week on various bills aimed at lowering premiums for all Americans. However, details about the proposed legislation remain scarce, and there is uncertainty about whether the House will vote on an extension of the expiring tax credits before their last scheduled session day on December 18th. Scalise emphasized that the GOP is working towards consensus, stating, "There's still some areas that we don't have full agreement upon, and we're going to keep working on those." The Republican leadership has been in discussions with various factions of the party for weeks to find common ground, but a significant divide remains, particularly regarding the Democrats' push for a 3-year extension of the tax credits. House Minority Leader Hakeem Jeffries has sought to force a vote on this extension, but it requires support from at least 4 Republican members to bypass GOP leadership. Jeffries believes that a 3-year extension would garner substantial bipartisan support in both the House and Senate. Meanwhile, the Senate is expected to vote on a 3-year extension, though it is unlikely to secure the necessary Republican votes to advance. Republicans have indicated that a clean extension of the tax credits is off the table, citing the need for reforms to combat fraud and impose income limits on beneficiaries. The expiration of these tax credits could result in average premium increases of over $1,000 annually, with estimates suggesting that premiums could more than double from $888 in 2025 to $1,904 in 2026. Moderate Republicans and Democrats are attempting to break the legislative stalemate, with several bipartisan proposals on the table. A proposal from Representatives Josh Gottheimer and Jen Kiggans suggests a 1-year extension of the tax credits with income limits, followed by more substantial reforms in the second year. Another bipartisan effort led by Republican Representative Brian Fitzpatrick aims to extend the tax credits through 2027 with an income cap and expanded access to health savings accounts, while also implementing a small monthly premium for the lowest income beneficiaries. As the situation unfolds, both Fitzpatrick and Gottheimer have introduced discharge petitions to force votes on their respective proposals, a tactic that requires majority support to bypass House leadership. However, the success of these petitions hinges on significant Democratic backing, as both proposals are designed to attract votes from across the aisle. In a closed-door meeting, Speaker Mike Johnson acknowledged the unease among Republican members regarding the lack of a definitive plan to address the expiring subsidies. Despite the pressure, he maintained that an extension does not have majority support within the conference, adhering to the informal Hastert rule that dictates legislation should only be brought up if it is backing from the majority party. As the clock ticks down to the end of the session, House GOP leaders are under increasing pressure to unveil a viable path forward that addresses the concerns of both constituents and party members. With just days remaining to build consensus, the stakes are high for the upcoming votes that could shape health insurance access for millions of Americans in the coming year. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.